Hey, so it's been a minute since I did any frequently asked questions. I am back with this question inspired by my niece over the past week. We were together and she started having some ear pain, and we went off on a journey to get her some herbal eardrops to get started. So I thought I would go ahead and make a little video. This is a question I get asked frequently is can you explain the connection between the need for dental expansion and the need for ear tubes? So let's dive in. So it's my understanding that in the US, one out of every five pediatrician visit is for an earache. So that actually is making it one of the most common reasons why a child ends up going to see a doctor outside of regular routine office visits. And aside from the fact that obviously this can be very painful for a child and it's unpleasant, we also know that ear infections can lead to hearing, speech, or learning challenges. And if this becomes a pattern, then children can end up with multiple rounds of antibiotics or even needing surgery, something like ear tubes. And it's really important when we think about the fact that even just early use of antibiotics, not whether it's repeated or not, is going to have effects on the gut microbiome and our future immune system and how it functions. So, just to explain, I know we talk about ear, nose, and throat doctors, but sometimes it can be a helpful visual to paint a picture of how this all connects. So we're used to seeing our ear from the outside, as you see here. And inside the ear, we go through the ear canal and end up in the middle ear. And from there, there is actually a tube called the Eustachian tube that drains into what we call the nasopharynx. So that is this connection from this blue star up here, this tube drains out, it exits into kind of, we'll call it the back of the throat for now, but our airway tube is broken up into the nasopharynx that starts at our nostrils and goes all the way through to the back of the throat, and our oral pharynx, and the two of those meet and go down, becoming the rest meeting all the way down into our lungs. Um, so what can happen here is that it's something where in younger kids, their anatomy, just the way that they're set up, they do have shorter tubes and they're more horizontal. So it makes it harder for them to drain versus being, as we get older, they start to tilt. The way that they're shaped is more tilted. And so in younger kids, it's just already set up to be harder to drain. And if you think about being like the advice that you get if you're on an airplane and you want your ears to pop, that's related to this kind of connection. So, chewing, swallowing, or yawning should briefly open the tube and allow for kind of both pressurization to equalize as well as draining of any liquids that build up in the middle ear. So, we're going to come back to this piece of where it exits into the upper nasopharynx area. We'll come back to that in a moment, but I just wanted to make sure that you're kind of understanding how it all connects. Beyond that, I always like to make sure that people listening to me get to know that the roof of the mouth is the floor of the nose. So that's another way to think about kind of connecting the nose and the mouth. It really is all connected. And when we think of someone having an earache, it's not always automatically an infection. So sometimes if it's not an infection, as was the case by my niece, by the time my niece got to the doctor, we had tried some natural drops, some garlic and mullein oil drops in her ear. And by the time she went to the doctor, she was fortunate to be told there was some inflammation, some irritation, but no infection. So it's not always the case that an earache means an ear infection, but we of course need to kind of check and see what's going on. It is actually commonplace to be recommended to sort of try some more natural remedies or try to wait it out a day or two if an earache starts. just because, again, it's not always great to jump straight into prescribing antibiotics, although antibiotics will be helpful if it's progressed to a full-blown infection. So in the case that there is no infection, the doctor may recommend some antihistamines and a nasal corticosteroid spray. This is going to be used to sort of shrink a lot of the inflammation in that nasopharynx area that I was talking about. So by shrinking a lot of inflammation, it's going to allow for any medicine that you put in through the nose to sort of arrive at that area where that ear tube comes to drain, and it can open up that passageway by shrinking some of the inflammation. So that's how a nasal spray that goes in through your nose can arrive back there and make a difference. Now, it doesn't always have to be a steroid. Some families, in the case of more routine use, can use something like clear spray, a saline spray, grapefruit seed extract, different things like that, that can be used for more ongoing use for just nasal hygiene purposes. But in the case that we're dealing with an earache, this is what the doctor might recommend. If there is infection diagnosed, then antibiotics will commonly be prescribed and they can play a helpful role. If this becomes something where it's recurrent and a child keeps getting infections over and over again, sometimes the recommendation becomes to place surgically a little tube that passes through and keeps that pressurized system in balance that way. So I mentioned already some of the herbal drops that can be an alternative remedy. There are some homeopathy options. But for me, coming from what I know, I want to make sure that any family is not just treating this, but also looking to address any allergies, any mouth breathing, or any oral dysfunction. From the dental perspective, I was talking about that opening and that we would come back to talk about that a little bit more. So you'll hear about enlarged tonsils and adenoids. That opening where the ear drains comes very close to where the adenoids sit in our body. If our adenoids get enlarged for a variety of reasons, then it can physically block the tube, and that's going to be one reason why fluid starts to build up in the ear. Also, if our tonsils are enlarged, then that's going to take up some of the airway space that we have. It's going to take up some of our tongue space, and it's going to make it harder to swallow. So if that's the case, then we're going to talk next about how swallowing is a regular way that, well, I already mentioned, actually, if you were trying to get your ears to pop, you might swallow, you might chew gum, you might yawn. It's because when you swallow, there are muscles that pull that tube temporarily open for a brief moment. And so if you have a proper swallow, you're pulling that tube open, but also other muscles in the area are kind of moving everything around that tube in the correct way. And if you have something alternatively like a tongue tie, then you're going to be having another method by which you're not going to have a proper swallow, and that's going to affect the ability of this area to drain. So also, it's not just with tongue ties, of course. There are a lot of reasons why an improper swallow might be present. You might have low tongue posture, you might have a tongue thrust, mouth breathing, and just poor oral tone. So it's not always just that like someone's doing the wrong thing. They may just not have the right strength of the muscles in place. And so that's something that therapy can actually work on to improve. Sometimes we need some help from some other providers that work on things with the nervous system, but those are different approaches to think about how we can improve things. And guiding back to the original question, how would the need for expansion be involved? Well, if we have structurally less space for the tongue, then we're going to have a higher chance for all the rest of this dysfunction to be taking place. So if we're not swallowing correctly, again, it's going to lead us into a situation with a higher likelihood of a number of issues preventing the middle ear from draining. And this is just an additional x-ray to show you so you can see when we look at something like the adenoids. Unfortunately, we can't see that. Tonsils we can see by looking inside a child's mouth. Adenoids do get visualized frequently by x-rays. Doesn't always have to be a 3D x-ray. A two-dimensional x-ray that an orthodontist would take would also show you this. But a lot of ENTs also use like a camera and will do a little scope so that they can get a view of what's going on. As I mentioned, the tonsils you can see by looking in the back of the throat, but you can see how these are some enlarged tonsils. And if they're really big and irritated, then the tongue it takes up less space. So the tongue has less space and we have less space to breathe through, further perpetuating that mouth breathing. And again, here with an example of kind of a crowded mouth, this person probably either had a thumb habit or a tongue thrust, a combination of both, but with a crowded architecture of the mouth, then everything is also going to be kind of squished from the roof of the mouth up to the floor of the nose. And all of that dental expansion is one method for creating more space in order to get everything to be able to flow again, the air to flow better, the ear fluid and ear passage to flow better. So that's how this is all related. The reality is that from a very young age, if we are looking at even starting with breastfeeding, the way that our tongue, the way that our muscles in and around our mouth function, either during swallowing or even the way that they rest when we're just doing other things, influence how the dental arches are going to develop and grow. So if the tongue is constantly low and if there's an imbalance between how the cheeks and the tongue are, then we end up with a sort of constricted arch form and hence the need for dental expansion. If, however, our tongue is resting where it should be in the roof of the mouth, if there's a good balance of the muscles in and around the lips, the cheek, the tongue, then everything forms this really nice arch form. And so that is another way to think about really how we go from the problems that contribute to the ear problems being the same problems that are often contributing to the need for dental expansion. Just for those who are kind of like, okay, so what do we do? There are a number of different therapies that help with swallowing. I know that may sound silly if this is the first time you're hearing that, because it seems like a very basic and fundamental thing. We do actually start practicing our swallowing capabilities in utero as a baby. So it is something we know how to do before we're even born. However, there is an extensive number of muscles that are involved in coordinating a swallow reflex. Our tongue alone has 8 muscles. Just trying to look at adding up our jaw and lip muscles, our neck muscles, the muscles inside our soft palate and our pharynx that I was talking about, and then meeting up with where it breaks off into the upper esophagus and the lungs. Then you can start counting a lot. I didn't count them all out for the purpose of this video, but Google was telling me could be 30, could be 50, just sort of depends. So I could count them out if we really need to sit down and do that. But there are a lot of muscles involved. And so that's something where there are specialists. Myofunctional therapists are one option, speech language pathologists, different like oral motor therapy, occupational therapy, physical therapy. So there are a different number of providers who can help. And as I was mentioning with some of the nervous system factors, sometimes it can be something where we actually need some help. Our ability to swallow changes as we grow up. So as babies, we swallow one way. Around 4 years of age, we kind of switch to what's called a mature swallow pattern. So if we need help from other kind of modalities, that might be something that goes beyond just getting the muscles trained. Sometimes there is a nervous system component. So kind of different approaches may be appropriate depending on what you're up against. And just to kind of go off from there so I don't leave you hanging, if you're looking for more resources, my free ebook, The Healthy Mouth Manual, does talk more about sort of nasal hygiene approaches and different things you can do to set up the mouth for healthy growth from an early age. I have created recently the Smile Support Stair Steps ebook that talks more about the different options if you're interested in exploring expansion. And I do meet with parents one-on-one to look at concierge consulting. That's the name I have created for just being able to meet one-on-one with parents and talk more about your unique situation, talk about treatment options, talk about providers. Right. Thank you.